Panic disorder is a mental health condition that many people experience. It is more than just feeling nervous or anxious. People with panic disorder have sudden and repeated attacks of fear. These attacks are often intense and can happen without warning. A panic disorder can significantly impact a person's life. It can affect their work, relationships, and overall well-being. Understanding this condition is the first step to managing it. This essay aims to explain panic disorder in simple terms. We will explore the symptoms, causes, and treatments. We will also share real-life examples. This information can help those who are struggling. It can also help friends and family understand what their loved ones are going through. Panic disorder is a type of anxiety disorder. It is marked by sudden and repeated episodes of intense fear. These episodes are called panic attacks. They can happen at any time and often without warning. Panic attacks can be very frightening. During a panic attack, people often feel as if they are losing control. They may think they are having a heart attack or even dying. These episodes can last from a few minutes to several hours. The fear of having another panic attack can lead to more anxiety. Panic disorder is more than just occasional panic attacks. It involves ongoing worry about when the next attack will happen. This worry can interfere with daily activities and quality of life. It is important to remember that panic disorder is treatable. Panic disorder has a range of symptoms. These symptoms can be both physical and psychological. It is important to recognize these symptoms. Early recognition can lead to better management and treatment. Physical symptoms include a racing heart, sweating, and trembling. People may also experience shortness of breath, chest pain, and dizziness. These symptoms can feel very similar to those of a heart attack. This often leads to increased fear during an attack. Psychological symptoms include intense fear and anxiety. People may feel a sense of impending doom or fear of losing control. They may also experience feelings of detachment from reality. These symptoms can make the person feel very isolated and scared. Understanding these symptoms is crucial. It helps in identifying the condition and seeking appropriate treatment. Knowing that these symptoms are part of panic disorder can also be reassuring. The physical symptoms of panic disorder can be very distressing. They often mimic those of serious medical conditions. This can lead to unnecessary medical tests and visits to the emergency room. Understanding these symptoms can help reduce fear and anxiety. A racing heart and chest pain are common symptoms. These can make people think they are having a heart attack. Trembling and sweating can make them feel out of control. Shortness of breath and dizziness can make them feel like they are about to faint. These physical symptoms can be very frightening. They can lead to more anxiety and panic. This creates a cycle that is hard to break. It is important to remember that these symptoms are not dangerous. They are a response to anxiety and can be managed. Managing these symptoms involves relaxation techniques and breathing exercises. These can help reduce the intensity of the symptoms. Knowing that these symptoms are part of panic disorder can also help. Section 5. Psychological symptoms and their impact. The psychological symptoms of panic disorder can be equally challenging. Intense fear and anxiety can make it difficult to function. These symptoms can affect a person's thoughts, emotions, and behavior. During a panic attack, the fear of losing control is common. People may feel like they are going crazy. They may also have a strong fear of dying. These thoughts can be overwhelming and hard to ignore. The fear of having another attack can be constant. Feelings of detachment from reality can also occur. People may feel like they are watching themselves from outside their body. This can make them feel disconnected and alone. These symptoms can interfere with work, school, and relationships. It is important to address these psychological symptoms. Therapy and counseling can help manage these thoughts and feelings. Support from friends and family can also be beneficial. Knowing that you are not alone can make a big difference. Section 6. Possible causes and triggers. The exact cause of panic disorder is not known. However, several factors can contribute to its development. These can include genetics, brain chemistry, and life experiences. Understanding these factors can help in managing the condition. Genetics play a role in panic disorder. It can run in families. If a parent or sibling has panic disorder, there is a higher chance of developing it. Brain chemistry is also involved. Imbalances in certain chemicals can contribute to anxiety and panic. Life experiences can trigger panic disorder. Stressful events such as the death of a loved one or a job loss can be triggers. Traumatic experiences such as abuse or accidents can also play a role. These events can create a heightened state of anxiety. It is important to identify personal triggers. This can help in managing panic disorder. Avoiding or managing these triggers can reduce the frequency and intensity of panic attacks. Therapy can also help in identifying and coping with triggers. Section 7. Impact on daily life. Panic disorder can have a significant impact on daily life. It can affect work, school, and personal relationships. The fear of having another panic attack can limit activities and social interactions. This can lead to isolation and loneliness. At work, panic disorder can make it difficult to concentrate. The fear of having an attack can be distracting. This can affect job performance and lead to absenteeism. In school, students may struggle with attendance and academic performance. Personal relationships can also be affected. The constant anxiety and fear can strain relationships. Friends and family may not understand what the person is going through. This can lead to misunderstandings and conflict. It is important to seek support and treatment. Therapy and support groups can help in managing the impact on daily life. Open communication with friends and family can also be beneficial. Understanding and support from loved ones can make a big difference. Section 8. Treatment options. Therapy. Therapy is a common and effective treatment for panic disorder. It can help in understanding and managing symptoms. There are different types of therapy available. Cognitive behavioral therapy, or CBT, is one of the most effective. CBT focuses on changing negative thought patterns. It helps people understand the connection between thoughts, feelings, and behaviors. By changing negative thoughts, people can reduce anxiety and prevent panic attacks. CBT also involves exposure therapy. This helps people face their fears in a controlled environment. Another type of therapy is psychotherapy. This involves talking to a therapist about thoughts and feelings. It can help in understanding the underlying causes of panic disorder. Therapy can also provide support and coping strategies. Group therapy is another option. It involves meeting with others who have similar experiences. This can provide support and reduce feelings of isolation. It can also be helpful to hear how others manage their symptoms. Section 9. Treatment options. Medication. Medication is another option for treating panic disorder. It can help in managing symptoms. There are different types of medication available. These include antidepressants, benzodiazepines, and beta blockers. Antidepressants are commonly used to treat panic disorder. They help in balancing brain chemicals that affect mood and anxiety. These medications can take a few weeks to start working. It is important to take them as prescribed. Benzodiazepines are another option. They work quickly to reduce anxiety. However, they can be habit-forming and are usually prescribed for short-term use. Beta blockers are also used. They help in managing physical symptoms like a racing heart. It is important to work with a doctor when taking medication. They can help in finding the right medication and dosage. Medication can be used alone or in combination with therapy. It is important to follow the treatment plan and communicate with the doctor. Section 10. Real-life examples. Real-life examples can help in understanding panic disorder. They show that you are not alone. Many people have successfully managed their condition. One example is Sarah. She started experiencing panic attacks in college. At first, she did not know what was happening. She thought she was having a heart attack. After several visits to the emergency room, she was diagnosed with panic disorder. Sarah started therapy and medication. She learned coping strategies and relaxation techniques. With time, her panic attacks became less frequent. Another example is John. He experienced his first panic attack at work. He felt a sudden wave of fear and thought he was dying. His coworkers called an ambulance. After medical tests, he was diagnosed with panic disorder. John started cognitive behavioral therapy. He learned to identify and change negative thought patterns. He also practiced breathing exercises. John now manages his condition and leads a fulfilling life. These examples show that panic disorder can be managed. With the right treatment and support, it is possible to live a fulfilling life. Section 11. Conclusion. A message of hope. Panic disorder can be a challenging condition. However, it is important to remember that it is treatable. Understanding the symptoms, causes, and treatments is the first step. With the right support and treatment, it is possible to manage panic disorder. If you are experiencing panic disorder, know that you are not alone. Many people have successfully managed their condition. Reach out for help and support. Talk to a doctor or therapist. Join a support group. Share your experiences with friends and family. There is hope. With time and effort, you can overcome panic disorder. You can lead a fulfilling and happy life. Remember, you are stronger than you think. Take it one step at a time. You are not alone on this journey.